Breaking news at this hour, we are following two big announcements. The House has passed the $2 trillion coronavirus stimulus bill. President Trump is expected to sign it at any minute, and we are in an update right now from San Francisco Mayor London Breed to the city's response to the coronavirus. So let's listen in live to Mayor Breed.
The Director of the Department of Public Health, Dr. Grant Colfax, the Department of Emergency Management Director, Mary Ellen Carroll, our Police Chief, Bill Scott, and our Fire Chief, Janine Nicholson, as well as other officials. And we are definitely practicing social distancing by having at least 6 feet apart from one another here in this location, but also this virtual press conference is an opportunity to demonstrate the kind of behavior that we want to see happening all over the city. We want to thank members of the press for their patience and for accommodating the change in order to help protect and keep them safe as well. And we also want to thank members of the public because we know for the most part, so many San Franciscans have really stepped up and really focused on social distancing and also helping to support and educate neighbors and other people as to what's most appropriate to do during this time. I know that we oftentimes refer to social distancing as saving lives, and I want to be clear that it will save lives. If we continue to practice social distancing every single day as we are during this stay-at-home order, we will get to a better place. But as Dr. Grant Colfax has said, we are at a really challenging time. We are seeing the numbers continue to increase as we do more testing. And we also know, as we said in the last press conference we held, that we will need more beds, we will need more ventilators, we will need more support. So what you are doing by socially distancing and staying at home and only going out for essential services, what you are doing is you are helping reduce the number of people who are infected. So I want to thank you all so much for everything that you've done to help us get this far. And I know it hasn't been easy. We still have a lot more time ahead of us than we do right now behind us. Your patience during this very challenging time is definitely appreciated. I want to start by providing an update on some real positive information that we just received because sadly we know that testing is very limited. In San Francisco, at the Department of Public Health, they've been able to administer now 150 tests each day. That does not include the private hospitals, and this is information that we anticipate that we will receive sooner rather than later. We expect to increase that number significantly, and Dr. Colfax will provide an update on where we are with testing and how we expect to extend our testing efforts more significantly than we have in the past. But the good news on that front is now, thanks to Kaiser and Blue Shields, we will be able to provide testing for the healthcare workers who are on the front line and working with patients who have been infected, as well as many of our public safety officials, our firefighters and police officers, and those who are on the front line. We will prioritize them for testing. We know that so many of them are very concerned that they are doing this work in the community. They are trying their best to help save lives and serve the public, but they are living in fear as to whether or not they have the virus, and they're concerned with going home and spreading that virus to other family members. We know that's a big concern, so getting the ease of knowing whether or not they have the virus or not is critical to protecting public health and safety. And so we will be prioritizing public health and public safety officials for testing. And Dr. Colfax will talk a little bit more about that as well. And I want to just also mention to the public that although we want to be tested, I know everyone wants to be tested to know and think that that could put an end to what we are experiencing. And I want to be clear that in light of having sufficient testing for all San Franciscans, social distancing is the key. And I know I keep mentioning it, but I can't mention it enough because regardless of how many tests or who we're able to test, that at the end of the day is going to make the most impact. So please continue to practice social distancing. I want to talk about, since today's Friday and the weekend is approaching, and we know what happened last weekend. What happened last weekend, you did see people who were out, of course, enjoying the fresh air, walking their dogs, walking with their families and kids, and practicing social distancing. But sadly, we saw a number of areas in our city that were just jam-packed. And we also saw people who were playing things like volleyball and basketball and other sports together that are not things that we are able to do at this time as a result of the order. And so just to make it clear, we are going to have to make some changes. The last thing I want to do, as I said on Monday, is to basically close parks. And so we need to shift our behavior and make adjustments so that people are not doing the kinds of things that are going to lead to the spread. As we go into this weekend, I just want to appreciate the fact that we've been able to close places like Alcatraz, Fort Point, and Land's End Lookout. And the federal government has already announced parking closures in the city, including Baker Beach and Ocean Beach on Sloth. So if you are trying to go to Baker Beach or Ocean Beach or Crissy Field, the parking will not be available. And we will be monitoring the neighborhood to make sure that there isn't an influx of vehicles that are impacting the parking in those particular neighborhoods. We don't want people to get in their cars and drive to Ocean Beach. What we want people to do is stay at home, and when they need to go out and get some air, walk outside, go and to a park within the proximity of your neighborhood. Please don't get in your cars and drive to Ocean Beach or Crissy Fields or other places like that. So we're going to be closing parking lots in Crissy Field, Fort Funston, and the lots in the marina and Ocean Beach, as we said, and specifically near Beach Chalet. So we hope that by closing this area off to cars, that people will start to get the message of why we are pushing folks to really try and stay, get your fresh air, walk your dogs, but don't get in your cars and drive to specific locations to play volleyball with your friends, to have picnics, to have wine parties. Zoom is a great tool to have wine parties and other connections with one another, with friends and family members. I've just discovered that as a very great tool for socializing. But the last thing we want to do, as I said, is to start to close the last bit of fresh air that we're able to get during this very difficult time. And so parks, we know, are essential. And I know other places have chosen to just close parks and other places down. We don't want to get to that place, but if we see more people playing in basketball courts, if we see more people playing volleyball with one another and baseball and some of the sports that are more team related, we will have no other choice. So it's still okay to go out and walk. It's still okay to go out and ride your bike and run. And I just want to give a message to the runners because I had an experience when I was out walking yesterday. I was walking in a narrow area and the runner still decided to run very close next to me. It would have taken like 3 seconds for the runner to wait until I crossed the bridge area to get by so that we could maintain that 6 feet. So I'm asking people to be considerate of one another. I'm not asking you to go out in the street and risk getting hit by a car. I'm asking you to just maybe wait a minute or two to allow people to pass within a safe distance. Again, we all can play a role in making sure that social distancing is practiced by everyone. And the fact is, we're in this for the long haul, so there's no need for any of us to be in a hurry. I want to also talk a little bit about what's happening with our homeless population. Because we know that there are so many people who are very concerned about what this could mean, not just for the people who sadly are sleeping outdoors, but what does this mean for people who are in congregate living settings like Laguna Honda, our single room occupancy hotels, and all of these other places. And so we have been working on a number of things, and I just want to talk a little bit about what we have done and what we will continue to do, and hopefully give people an update on where we actually need to get to as well. Starting next week, Moscone West will open up, and supplies are being delivered this weekend. People are being coordinated. We're going to use Moscone West as a place to thin out our shelters so that we can start to have places so that people who are, again, living in congregate settings like our shelters can be spread out a lot more. So Moscone West is going to play an important role for that. And we'll have some more information about that later on. And I also want to talk a little bit about the hotel rooms. As was mentioned earlier this week, we put out an RFP for hotel rooms that can be used for people who are in congregate living settings, people who are homeless, as well as some of our first responders and our healthcare workers and those who may not want to go home because of their concerns around impacting their families. And we have been able to, because there's, even with this declaration of an emergency, there's still a process, there's still insurance that needs to be worked out, there's still staffing needs and security needs and support and resources. And so far we've been able to, this week, secure at least 300 hotel rooms for self-isolating or for quarantine for either folks in our SROs or people who are homeless. And we estimate that by next week, we'll be able to secure at least another 3,000. So bringing on, as we said, some much needed hotel rooms, and we will keep working towards, making sure that those people who are in congregate settings and other places have a space to themselves so that we can reduce the transmission of the virus. And so that's the update that we have so far. I want to take this opportunity to especially thank the people who are here at Moscone South, the people who are here working every single day in the Emergency Operations Center and doing the hard work, coordinating the hospitals and the PPE and testing, the stuff that we're doing, just the small things, like even making sure that the shelters are still getting food, that we are getting food to seniors and other people, that we are talking and reaching out to those businesses who still have remained open or have some real challenges financially and need help. So many people here at the Emergency Operations Center have stepped up to do their part in providing information and resources to the public. And we really also want to express our appreciation because we have gotten a lot of great ideas from members of the public through social media. People have made a lot of great recommendations, and we take those recommendations to heart because we are all in this together, and no one is in charge or responsible for all the great ideas. It's going to take a team effort. It's going to take all of us working together, looking out for one another. And I want to also just really express appreciation to so many people in the city, because I noticed that on places like Nextdoor and in some of these chat rooms where neighbors are communicating with one another, I noticed that so many neighbors are looking out for their neighbors who are seniors and people who can't necessarily get out to get their groceries or their medications. And so there have been so many great neighbors running errands for so many people who can't get out. And it's just, you know, it's a challenging time for all of us, but it is definitely bringing out the best in us. And so I just want to express my appreciation for so many people who are not only doing their part to stay at home and only go out for essential needs, but also what you've done to help touch the lives of other people who can't take care of themselves in the same way. So that's where we are. That's our update. Lots more work to do, but as I keep saying over and over, we are, yes, in the midst of this, so it may feel like this is very challenging for all of us, and how much longer can we take it? Well, the fact is we're going to have to take it a little bit longer because it does mean that we save lives. And so again, we appreciate your patience and your cooperation. We'll continue to do everything we can to provide updates as we receive them with the most accurate information so that the public knows what to expect. Because as I said before, the last thing we want to do if someone is facing a medical emergency, the last thing we want to do is turn them away because we don't have enough beds. So let's keep that in mind as we go into the weekend, and let's try to remember that and do our very best to get through this. I'm cheering for all of you. I'm cheering for our city. I'm cheering for our country. So thank you all so much for your cooperation.